and your pets. When it gets that hot, we've also got to watch out this time of year for those fleas and ticks. Dr. West, your second visit. You were so good the first time, we had to have you back.
Thank you.
We've got a nice friend here.
Yes, that's Dalton. No, this is my office manager, Bob's dog.
Bob's dog.
Yes.
Beautiful. 11-year-old chocolate lab.
Yes,
correct?
yes, he's a big, handsome boy.
He sure is.
And he's on heartworm and flea prevention.
Is he well behaved or what? I mean,
yes,
giant.
Great.
Fantastic. Okay, so let's talk about it. I've got a big field in my backyard. My dog's out there all the time, Barney, sniffing around, looking for stuff.
It's a bad year this year, especially because we didn't get that cold of a winter.
Right.
So we're looking at a pretty bad year for fleas and ticks, for sure. And so what we're recommending is that, you have to be very careful with the deer tick in this area, especially with the amount of deer we have.
Right.
And that's what spreads the Lyme disease. And then with the fleas, they lay about 2,000 eggs a week.
Wow. I didn't know that.
Oh, yeah. And each one of those eggs takes about 3 months to mature to an adult. So that's why it's so important to keep your pets on heartworm and flea prevention year-round, because it's a continual cycle. Plus, we don't get cold enough to kill off all these things. Okay. And so we recommend that 95% of the problem is living in your carpeting and your environment and the bedding. 5% of the problem is the actual adult flea that you see on the patient.
Really?
Yes.
Okay, so it's almost the invisible menace,
it's
really.
It's the invisible menace that you're seeing that's creating a lot of the problems. So you have to attack fleas from all different angles, because they're pretty pesky bugs and they've been around for a long time.
Before we get into some things that we can use to prevent those, what do you want to do with like Dalton here to check for fleas?
Well, you just want to take a good look. Fleas like to hang up here around the neck.
Up
and
in
down,
the withers?
Yep, and down here by the tail base. They like to hang out here, and they're going to be present there mostly. Some dogs are allergic and some dogs aren't, so some will scratch and some won't, based on their allergies to the flea bite. And you just want to keep a nice good look. If you have a flea comb, take it through once or twice a week.
You'll want to check, and if you don't have, if you're not taking preventative measures yet, do your check first, and then you go to this.
Yes.
Some preventive measures.
Preventive medicines, yes. And so there's a whole slew of them, and it doesn't actually always matter exactly which one you're using, but you want to use a quality product from a reputable place, because I've seen a lot of bad reactions from some of the over-counter products.
Like allergies and stuff like that, things that aggravate the coat?
That, and it can be a lot worse. Some anaphylactic reactions and some bad things that we've seen. So you
get
just
a reputable name.
Yes, and what a lot of people don't realize too is when you're getting these products over the, on an outsource of a veterinary hospital, you lose your warranties. So you lose your warranty from the company, and you also lose a lot of rebates and things like that from not buying them in-house in a veterinary hospital. Okay,
now we got about 30 seconds left. Are these things that they take orally? Is this something like for Barney and Tudor, I put some between their withers, a couple drops here a few times a year?
There's a few products like Trifexis, which has a combination. So you're going to get flea and heartworm preventative altogether. And then there's the other products that that just do one or the other. And basically you're going to be putting a lot of the topical products like Advantage and Revolution in between the shoulder blades on the skin. That's the most important thing there.
Get it down underneath the coat. Kind of rub it in backwards against the grain of their coat.
Exactly. You want to make sure it's in their skin. And then the other oral pills, you just want to, most of them you want to give with a meal. Okay, great. Put in some hamburgers. Yes, exactly. Well, Dr. West, great tips, and we thank you and Bob for bringing Dalton in.
No problem. Great big boy.
Thank you.
And we're going to have you back in another couple weeks. We look forward to future segments with you.
Sounds good.
Thanks so much.